6.5 million, I think, people who are paying the penalty right now. You've got about 9 million people who are just in the individual market outside of the exchanges or on the exchanges who are basically buying unsubsidized insurance, and they're feeling the most pain around these cost increases. And then you've got the young population that isn't participating as much as we would like, because we're really talking about two different populations on the exchanges, and those are people with low expected health risk, low risks, who are in the market temporarily, and then they're going to leave, and the people who, for one reason or other, are going to be there. And I think the Republicans want to, and I think should, look around ways to lower the costs to that population to get more of them to participate. I think the ACA's mandate is, as written, actually too weak, and there are ways that Republicans could think about, either through a continuous coverage requirement or something else, that would actually strengthen the requirement, but recognize the fact that, at least on the right and probably in the middle, the mandate itself is deeply unpopular.
Let me just explain continuous coverage to you and why it's such a rotten idea, and why the Congressional Budget Office said, it's actually going to lower the number of people in it. Say you're 30 years old, and what they tell you is you're not continuously covered. You're going to pay a 1-year penalty, 30% higher premium. I'm not continuously covered. And then one of those disasters happens to me. I get into a bad accident, and some bus hits me while I'm riding my bike, or I get cancer. My medical bill is going to be $100,000. What do I care if I pay a 30% penalty? I'm going to be getting $95,000 worth of services for, call it a $2,000, $3,000 premium. Great deal for me, even if I have to pay the penalty. And it makes perfect sense. Now, more people are going to say, I don't need the insurance, I'll just pay that penalty. It's a terrible way to get people in. The surefire way of getting people covered, there is one surefire way. It's called auto-enrollment. You don't got coverage any other way, we auto-enroll you into a plan. That's what basically we do with Medicare Part A. It's what I like.